right. Good morning, good afternoon, good evening. We're just stabilizing our connection here. Thank you for joining us today. Once I get the a clear connection here on my end, then we can start. All right. I think we're good. Good morning, good afternoon, good evening, everyone. uh, and to all our supporters, likers, followers, good Sunday or good Saturday to all of you, and to our friends, our Christian friends and Catholics. Happy Easter to everyone. Hope you guys are enjoying your day or are starting your day good. So thank you for joining us today for another episode 5 of Ang Artimo, and I am your host, your respiratory therapist, Michael Di Peralta. So, good morning, good afternoon, good evening again, everyone. Just okay. So, today's episode, or episode 5, we will be joined by our guest speaker for today, Mr. Ritche Caburnay from Pampanga in the Philippines. So, we will introduce him in a little bit here. And we would like to thank our speaker for last week's episode, for episode 4, Professor Alan Gonzalez from Los Angeles, California, to Professor Mark Alfaro from FINMA St. Jude College, Manila, and Dean Rinalisa Bugsulin from Baguio City, Pine City College, and also, one of our guest panelists too, and our current guest speaker for today, Professor Ritche Caburnay from Pampanga, Philippines, Philippine Rehabilitation Institute. So, thank you for our panelist and guest speaker for last week. We do appreciate your time and sharing your expertise and knowledge to all of us here. And also would like to congratulate our winner for our last week's episode, Miss Desiree Antonio. Congratulations. She is the winner for our 1,500 Philippine pesos for our last week episode. So thank you, and congratulations. Hopefully, I hope that you're having a good time and enjoyed our last episode. Now, moving forward to our episode for today. Again, our thoughts and prayers to our frontliners, our fellow respiratory therapists who are fighting again this big surge of COVID 19 that is hitting our beloved country in the Philippines. I believe from Luzon, Visayas, Mindanao, we have surge everywhere. So our thoughts and prayers are with you. We are with you on your every shift. Please do take care of yourself. Please do take care of your family, and let's take care of one another. I think that's the big part of it. Be available and be there for one another. Again, we are fighting all this as one great RT team. So let's stay safe, let's stay strong, and let's pray for one another, mga kabaga. So that's that, and also, again, as we receive news from our different colleagues from the profession, not I'm shocked, and again, with our colleagues that are affected with COVID-19, our prayers are with you. If you need anything from us, please let us know. We will do what we can for you, and again, we're praying every single day, every single night for your fast recovery. To all our fellow RT colleagues there that are suffering from COVID 19 or whatever disease, please, do take care of yourself and your family. We are here for you and praying for you. Okay, and I believe that's all I have. Please stay tuned again for the flow of our program. We'll have Q&A with Mr. Ritchie Caburnay, and then he will have his presentation, and then after his presentation, we will have our question and answer portion, our kind of like game kanaba version of ang Artimo, and one person will get a chance to win our pot money again, 1,500 Philippine pesos. You know, um, by sponsored by ang Artimo. So maraming salamat po, and without further ado, I will introduce you now to our guest speaker for today's episode, Professor Ritche Caburnay. Good morning there to you, sir, and happy Sunday. Welcome to the show.
Hey, good morning, everyone. Good morning, good evening, good afternoon, wherever you are right now, part of the world. And happy Easter.
Thank you for joining us today again, sir. We do appreciate it on this lovely Easter Sunday. We do appreciate your time to be here with us and, get to know you as our respiratory therapist for today's episode. And then later, with your presentation, we will get to know more about who you are, sir, and what you will share about RT in polysomnography and RT in subspecialty. Now, we will start to get to know you more with these questions. Sir, first question is from what respiratory therapy school you graduated from?
Okay, I graduated my bachelor's. Actually, it's both my associate degree and bachelor's degree of respiratory therapy at St. Jude College in Manila
Awesome.
in
Thank you.
1997, 1999.
Oh, good. Thank you. Thank you. We don't want to reveal age, but thank you for answering thank you for sharing the year too. I think that's fitting for the next question. How many years have you been in RT?
Oh my goodness. That if it's 1999 and 2021, that would probably be 22 years.
Awesome. 2 decades of wonderful respiratory therapy years. And now, sir, is respiratory therapy school your first degree, or are you a former, a former professional before respiratory therapy?
Well, actually, I took my other pre-med, allied health course, which is physical therapy, at another university. Then I actually transferred to St. Jude College,
Mm-hmm.
and instead of pursuing physical therapy, I kind of interested in the practice of respiratory therapy by looking at the curriculum itself. So
Mm-hmm.
I was wondering, this would be a little bit interesting. So that's the reason why I shifted from PT to respiratory therapy, and well, the rest is history.
Mm-hmm. All right. Thank you. Thank you. I think it's a, very good choice. I think the next question is why respiratory therapy?
Well, technically, it's a challenge. It's a challenging profession actually,
Mm-hmm.
but it speaks more of patients or patients with pulmonary
Mm-hmm.
condition. And I was kind of interested because I've seen a lot of experiences, not only on television but also in real life, where I experienced seeing
Mm-hmm.
people who are intubated. Are I was thinking, are the only is only the doctors who's actually doing or performing
Yeah.
intubation
Mm-hmm.
and for patients. That's why I was kind of interested because there was this one um, program or subject in the respiratory tech, which is airway management, and it actually deals with intubation, BLS, ACLS, so on and so forth. However, it really kind of interested me on that perspective. That's the reason why I was into it, and also at the same time because I have some of my relatives who are also has pulmonary problem, at
Mm-hmm.
mostly asthmatic patient or asthmatic relatives. That's why I kind of ventured into that course or that course, and it's right now it's giving me more opportunity to tell everyone that respiratory therapy is one of those professions that are, let's just say, not well known to others, but it has a great deal of responsibility in taking care of our critically ill patients.
Mm-hmm. Thank you. Thank you. It's wonderful. Thank you for that. Also, next question. Sir, would be I know you mentioned you got your associates, your bachelor's in respiratory therapy. What are your current credentials, if you may share, in other higher degrees?
Oh, okay. Thank you.
Mm-hmm.
Well, aside from being an associate degree in respiratory therapy and obtaining my bachelor's degree in respiratory therapy,
Mm-hmm.
I also got the chance to pursue or finish my master's degree in hospital administration,
Mm-hmm.
also from St. Jude College, and at the same time obtained my not actually license, but a uh, um, certificate program
Mm-hmm.
as a hospital administrator for the Philippine College of Hospital Administrators. It's
Mm-hmm.
actually more deals with the administrative side of the hospital
Mm-hmm.
on how to manage or how to deal with situations in the hospital.
Mm-hmm.
And aside from that, again, with my current with my degree or my license as a registered polysomnographic technologist from the board of registered polysomnographic
Mm-hmm.
technologists. So that was my a pinnacle point actually in my career becoming a subspecialty in the RT profession.
Mm-hmm. Thank you, thank you. That's wonderful because again, respiratory therapy is a wonderful field, but and having an advanced degree, especially with hospital administration or business administration with focus on healthcare management. We would love to see that RTs are not only good with bedside care, but also we are could be good leaders as well.
Yeah,
Yep.
I agree. I
Yeah.
agree on that.
Thank you, thank you. And then next question is with your 22 years, if I did my math right, about 22 years of RT experience, if you may share, where have you worked? You don't have to mention every single thing, but I think, the just share what you can share with us, where have you worked?
Okay. Well, actually, during the span of my 22 years of being a respiratory
Mm,
therapist, both as a clinician and as a professor, I have again ventured into a lot of
mm,
job opportunities.
right.
I used to be a professor of respiratory therapy in Mary Johnston College and Mary Child's
Mm-hmm,
College.
mm-hmm,
I was a former faculty of the College of Respiratory Therapy in um, um, Mary Child's College, rather. I am currently the one of the professors at the Philippine Rehabilitation Institute in Quezon City for the academe part. For the clinician part, I've been working in St. Jude Hospital and Medical Center for a very long time. And then I used to have my, how do you call it, my training also at the Philippine Heart Center
mm-hmm,
before I ventured into the teaching career. So mostly, majority of my career as a respiratory therapist are actually dealing more
mm-hmm,
of the academe part. Now I've been given the chance to work in one of the biggest hospitals in Central Luzon, which is the Jose B. Lingad Memorial General Hospital,
mm-hmm,
where I am one of the supervisor for the section of respiratory care services,
mm-hmm,
together with my colleague, Mr. Michael George Verhelshaw. And basically, our experience for both of us, because the good thing about it is that MJ has an experience in respiratory therapy overseas. He
mm-hmm,
used to work as a respiratory therapist in the Middle East, wherein which on my part, I was having my experience here in the Philippines. So we kind of ventured together in terms of our practice for both abroad and here
mm-hmm,
in the Philippines, and kind of merge it into what we are trying to pursue in obtaining the how the RT profession in the Philippines should be like, and so that we will be able to be well known, we
mm-hmm,
will be able to expose ourselves in terms of how are we working as a respiratory therapist.
mm-hmm.
So basically, those are of my experiences, and I hope that this is an opportunity for me to share to people how it feels like not just only as a clinician but also as a professor as well.
Yeah, thank you for that. You know, it's a wonder. You are a very busy man from what I've heard from few people and from what you have said, and that's a good thing. We will, having a academe, a professor, working at the bedside still. You could, you are able to share the theory, but as well as share your current practice of respiratory therapy in the field. And the students do appreciate that. As a former educator too, you know that you can apply the theory, and then what are we doing at the current moment, with the theory that we're sharing. So you could, as I always tell, our students, you have to separate what is in the theoretical part, because that is what the book is saying, most particularly, our Egans is saying that. But how do we do it um, in the bedside? Because it could be different. So that's a good thing. And as well, everything that you've mentioned, it's such a wonderful thing that, to know someone like you who've been practicing in the Philippines for a while, and as well your co-supervisor have practiced abroad. Because working in abroad, like I personally, I have not worked in the Philippines. I had not graduated from the Philippines. But if somebody like me, say I graduated from the Philippines but have work overseas, I could say that, hey, we don't do it like that in the Middle East. We should be doing like this. But then again, we have to work with what we have in this particular hospital, and what our doctors allows us to, or what our laws and regulation allows us to. So I think that's a good partnership, having you both managing your hospital. You guys are fortunate to have a supervisor like you and your other
Yeah.
co-supervisor.
Well, I think it's an opportunity for both of us to
Right.
really share
Mm,
whatever experiences that we had,
right.
not only both in practicing here in the Philippines, but also what he is in practicing in the Middle East,
Right.
and coming up with a better protocol or program for respiratory therapy.
Mm,
I think it would be best that if we both share whatever our knowledge and expertise for both experiences here and
mm,
abroad, then maybe it would be a helpful tool for all of us
right.
to really be aware, and all for the other healthcare professionals as well, to be aware of what our practice is or
Right.
what our profession is.
Right. True, true, true. Thank you for sharing that. And moving on to our next question is, um, speaking of hospital work, what is your favorite unit or assignment in a hospital? Is it ICU, emergency, or floors? If you can share that to us, sir.
Well, I think it's more of the intensive care unit.
Mm-hmm.
Handling with critically ill patients and dealing with critically ill patients is
Mm-hmm.
a very challenging part of our profession as a respiratory therapist.
Mm-hmm.
The good thing about it is that during my experiences here in my previous hospital where I used to work, there are certain, when you're working with doctors specifically in terms of patient management intervention in critically ill patients, sometimes there again, there are some doctors who
Mm-hmm.
would most likely agree with your suggestions.
Mm-hmm.
Some of them would might disagree with your suggestions, and some of them might, sometimes the doctors also listens to, yeah, it's a good
Mm-hmm.
suggestion, we can try that one. And then came into the point again. I'm going back to my experience with MJ.
Mm-hmm.
Uh, when he introduced his approach in critically ill patients, specifically his experiences abroad, it really broadens my mind in becoming more aware of what we can provide more in terms of prevention and management for our patients. And I've really been observing
Mm-hmm.
him doing that one in terms of talking,
Mm-hmm.
really encouraging the doctors that we should be doing this, we should be doing that. And that's the reason why I really love more of dealing with those patients. Because, when you're working in the wards, when you're working in the non-critical wards, of course there will be some interaction with your patients. There will be interaction with your doctors. You also perform procedures, aerosol therapy, oxygen therapy, and the likes. But when you are dealing with critically ill patients, it gives you a great sense of, you know, happiness and satisfaction when you do perform your job well in terms of ventilator management, weaning the patient from the mechanical ventilator, and in the process of extubation. Really, it really gives you that sense of completion and satisfaction
Mm-hmm.
when you see your patients improve their condition right after that you've given them such a big, great deal of intervention and management, and a
Mm-hmm.
lot of encouraging from the doctors as well.
Right.
Like, of course, that's how I am and how I feel,
Right.
and really that's another opportunity for me. And aside from that, I think that me as a sleep technologist
Mm-hmm.
also have given me that kind
Mm-hmm.
of an awareness as well as to in terms of dealing with patients with obstructive sleep apnea. And it's not a job being a sleep technologist, mind you, because it's literally your you're looking at the patient sleeping,
Right.
and you're not sleeping as well. So you're
Mm-hmm.
monitoring everything that is happening to the patient. And I
Right.
think that's one of the challenges as well for me because I am not a night person, to be
Mm-hmm.
honest. I'm not a night person.
Mm-hmm.
So of course with my age, it goes with age as well. So it's kind of instance that you might be sleepy, but
Mm-hmm.
you kind of realize that this is happening to your patients.
Mm-hmm.
So it's a rewarding job as well
Mm-hmm.
as a sleep technologist, other than being a respiratory therapist in the critical care areas.
Agree. Agree. Thank you for sharing that. It's a good thing that you mentioned that, it's, people could say that, yeah, it's the doctors ordering whatever. Because even here in the United States, it's not you just doing it. You could do your suggestion, but I think the key on that is how do you deliver how do you deliver your recommendation, and how does the doctor see you as a respiratory therapist, and or as respiratory therapist as a whole in your department and institution. If you have given a suggestion and then you have given them the rationale, the rationale, and then you have given them, what would be a possible outcome, the doctor could take it because again, you are the lung expert. Then, with, the way you deliver your recommendation and how they see you as a respiratory therapist, that's a big part of, the recommendation process. And if you continue to prove that your suggestion have been working well, and you are having good outcome with your patients, then maybe these doctors will continue to trust you as a respiratory therapist and trust your department as a respiratory therapist. Because we can, people could say that, hey, we're just respiratory therapists. We just do what the doctors do. But then again, the culture has to come from you, your department, and in your institution. Then you could build your own. Yes, we're the respiratory therapists, and we got this. We rock. We could take our suggestion. Doctors, listen to us, and maybe collaboratively you could have a good outcome for your patient, and that's our goal. All right. Next question, sir, is um what is your favorite respiratory therapy intervention? As I think Do you like? I think my question would be, yeah, what's your favorite respiratory therapy intervention? Something that you love to do, you're proud to do. Something that a respiratory therapist can do. Like, is it intubation? Is it assisting with a ventilator, managing a vent? Is it it's just whatever. I think it's kind of vague, but
I think one of the most interesting part is the when we had the introduction of the high flow nasal cannulas or
mm,
nasal system here in the Philippines. Because supposedly before, there was this common practice of applying CPAP, right,
mm-hmm,
to our patients. But we rarely have that opportunity. Probably, I guess, probably not. It would not apply in our institution before, because I think that the introduction of non-invasive mechanical ventilation has already been done and approached in the different hospitals here in the Philippines.
Mm-hmm.
I think that's the most challenging part because it gives me that sense of sense of achievement that you can have the option of not intubating the patients
Yeah.
by introducing high flow or high frequency or high velocity nasal system. And
Mm-hmm.
if the patient is continuously improving with a high frequency or a higher flow rate,
Right.
and the patient is improving well, then it means that the patient uh, is supposedly not going to be intubated, and
Mm-hmm.
it's a rewarding part on my end to be on that perspective. Or sometimes if we can tell the doctors and doc, I think it would be preferred instead of putting the patient in a non-rebreathing mask
Right.
for better oxygenation.
Right.
We would suggest. I think it would be best if we can put the patient into a high flow or high velocity
Mm-hmm.
nasal system. I think it would be more improving on this part of ventilation and oxygenation.
Right.
And when the doctor says, okay, let's do that one, let's try to observe the patient if they will be improving or not, then obviously we've been doing that one as part of our protocol prior to intubation, specifically for our COVID patients, COVID
Mm-hmm.
suspect or COVID confirmed patients. So um, we have been observing the improvement, not in the sense of it improves them drastically, but of course slowly but surely that you see the improvement on their end when we are putting them on the
Mm-hmm.
nasal velocity or nasal flow
Mm-hmm.
system.
Mm-hmm.
So I think that would be the challenge. Aside from that, of course, the part of the intubation,
Mm-hmm.
assisting during intubation, because as you all know, in the Philippines, as much as we wanted to intubate patients, of
Mm-hmm.
course, there's still a hierarchy that doctors are the one
Right.
who performs intubation. Although when I'm teaching actually airway management to my students, I put there on the list of the people or of the healthcare personnel that is designated for intubation. I think I put the respiratory therapist as third or fourth,
Mm-hmm.
aside from the anesthesiologist, the
Mm-hmm.
intensivist,
Mm-hmm.
the general practitioner doctors.
Mm-hmm.
I put respiratory therapists as part of it because supposedly have been teaching that one. I can't say that we're good at intubation
Mm-hmm.
or we're better than the doctors, but we can perform intubation. And I think that it's a great opportunity for also the doctors to be aware that we can also do that one. Not as proving to them that we are great on it, but we can do it in the event that
Mm-hmm.
there is a like scarcity of doctors, for
Right.
example, or doctors are toxic, or
Yeah.
doctors are unavailable for the intubation, and the
Right.
patient is really in need of
Right.
intubation. Then I think that they should be giving us the opportunity to do that
Right.
one. And who you know whatever happens and it can improve the patient, then so be it. And I guess that's how I see it as an achievement on the part of respiratory
Mm-hmm.
therapists. Also at the same time, of course, ventilator management, proper ventilator monitoring, extubation process, weaning, successful weaning is one of course one of our achievement as well. And if you see that the patients are improving in terms of your approach in successful weaning, because sometimes there are doctors who are ordering, okay, let's wean the patient, but
Uh-huh.
when we do the extra weaning process, we have the criteria, we have the
Mm-hmm.
protocol. Sometimes they fail the criteria and
Mm-hmm.
protocols, so we kind of step back a little bit and try to
Yeah.
inform the doctors. Doc, I suggest that we should not uh, wean the patient yet or extubate the patient yet because in terms of our protocol or criteria, the patient is not yet eligible for an extubation criteria or
Right.
successful weaning criteria.
Yeah.
So I think we should be able to do that one as well. So I
Yeah.
think it's a better intervention management
Yeah.
for them to be involved as well.
Mm-hmm. Agree. Yeah, thank you. Yeah, that's a very great, very great points that you shared with us. I think I do have a follow-up question with that. As mentioned, before COVID, though COVID is really, have hit us negatively, mostly. it's kind of a blessing in disguise, especially for the respiratory therapy profession, especially those hospitals who did not have, or who don't have high flow nasal oxygen devices. But now, due to COVID, it was introduced, and now many hospitals or institutions are using it in the Philippines, which is a very great tool in order, as you mentioned, to prevent, hopefully, a non-invasive ventilation, and also, most importantly, is to prevent an invasive ventilation. I think the question there is, we're not promoting any company or device, but I'm curious, what high flow nasal oxygen device do you guys use in your institution?
Well, supposedly the Department of Health was able to, yeah, we're able to donate a high flow nasal system or a high flow nasal cannula in our institution.
Mm,
Not only in our institution in JBL, but also other government
right.
hospitals. So supposedly we are using the Airvo
Mm,
series of the nasal cannula
mm-hmm.
system. Although we were being offered, or we were being yeah, offered actually. There was another company who demonstrated the Vapotherm, and I think that the Vapotherm is actually quite well known in US,
Yes.
and the company that actually is distributing that product already have shown me
Mm-hmm.
the benefits of it, because there's a difference between a high flow
Right.
nasal cannula and a high velocity
Right.
nasal cannula.
Right.
So I got the chance to use both of them, and supposedly when I was observing, because it was being demonstrated to us, so the Vapotherm was being tried to one of our patients in the COVID ICU at the time,
Mm-hmm.
which shows improvement, actually, an increased improvement
Mm-hmm.
in dealing with patients with COVID-19. At the same time, also in preventing intubation for these patients. But of course, when we had the Airvo
Mm-hmm.
or the high flow nasal cannula, of course, there's a big difference. But nevertheless, whatever that has been given to us, whenever that we
Right.
have tried, as long as will improve the breathing, the ventilation, and the oxygenation of the patient,
Mm-hmm.
and in preventing like intubation, then
Mm-hmm.
I don't see any reason why we should not be using this one. It's a great tool for us.
Mm-hmm.
Probably before the pandemic started, of course, we didn't had yet the equipment or the gadgets for the high flow or the high velocity nasal system, because probably, of course, when you're in the government, you only have allotted the
Mm-hmm.
budget for specific
Right.
equipment. So instead of having that one, we should rely more of providing mechanical ventilators.
Right.
Now, as much as we wanted to promote the non-invasive mechanical
Right.
ventilators using our own mechanical ventilators machines, we don't have much of the consumables or the mask, the
Mm-hmm.
nasal mask or the nasal prongs to use it, probably because of the cost
Mm-hmm.
of it, because it's
Right.
too pricey from our end. That's
Mm-hmm.
why we're unable to use it. And remember that in the government hospitals, patients are more indigent.
Mm-hmm.
Of course, the class type of patients that we're handling are class B, C, D, or B, C, D, and E. So therefore, these are some of them are the poorest of the poor. Some of them are indigenous people.
Mm-hmm.
Some of them can't afford really for you know, a better or complete facility.
Right.
That's the reason why that as much as we wanted to give
Mm-hmm.
them the best approach
Right.
for them, but we don't have the availability of resources, we can't actually do them. It's a good thing. I'm still saying it as a blessing in disguise of this because of this pandemic, because it gives us the opportunity to introduce this machine or the
Right.
high flow nasal system to our doctors,
Mm-hmm.
so that the next time that will be having patients that are having difficulty breathing or dyspneic and they are candidate for intubation,
Right.
that we can really suggest, doc, I would suggest we can have this one first, so that we can verify, or we can actually check if they're going to improve or not.
Right.
So I think that's one of the pitfalls of working in a government institution, probably
Mm.
of the resources that we have.
Right.
If we have a lot of government funding for a better equipment and a better
Mm.
supplies, then we most likely wanted to introduce a lot of respiratory
Mm.
care protocols and intervention to our patients.
Mm. Right. Yeah. Thank you for sharing that. Then that topic, high flow nasal oxygen. We're that's a great topic. Like that's one of our topics that we're looking for a resource speaker. So for our our audience, we are looking into your suggestions of topics, and we will introduce that and we will present that in our subsequent episodes. Should just hang in there. But also true, I do agree that limited resources, funding is a problem anywhere in the world, and you gotta have to work with what you have, and but also think about what could also save this patient life with what we have right now, or could possibly prevent it. And that's a totally different topic that we could discuss. But yeah, thank you for sharing. That's a very good piece of knowledge that you have shared with a lot of us. And hopefully you know we all hope with our Republic of the Philippines, our motherland, that someday that we could truly promote a socialized medicine which is truly free and funded by the government. But again, we could just hope and pray, and hopefully that could be a possibility sometime in our lives in the near future. Next question, sir, is what is your message to our aspiring respiratory therapist?
Oh, okay. Well, well, thank you for that question.
Yeah.
Well, actually, for those students who are actually enrolled or is studying or currently studying respiratory
Mm-hmm.
therapy, I think that take this opportunity for you to be able to understand how your profession is. It's not just it's not just a course or a program wherein which it's just your second or third choice, because your previous programs, you failed on your previous programs.
Mm-hmm.
Take this opportunity at the time of pandemic, that this course or this profession as a respiratory therapist is essential in handling and dealing with patients, specifically with the COVID during the COVID-19 pandemic. And we have encountered a lot of experiences from our patient that had pulmonary problems, that had pneumonia-like symptoms,
Mm-hmm.
and we really wanted to give them the best respiratory care that we wanted,
Mm-hmm.
as long as you give them the appropriate management intervention. Take this time as a blessing in disguise for your profession, for your course as a respiratory therapist. Because right now in the Philippines, we definitely need a lot of respiratory therapists in different hospitals, not just only because of the pandemic, but it is an essential part of the allied healthcare profession, specifically dealing with patients with pulmonary problems. And how are you able to give them proper management intervention, better mechanical ventilation, better modes of ventilations? We can also venture into a lot of subspecialties, which includes pulmonary function technology, also with pulmonary rehabilitation, and also becoming a sleep technologist. So you're as an RT, there's a bigger space for you to be able to explore your capabilities, and not
Mm-hmm.
just only here in the Philippines but also overseas, where respiratory therapists are being regarded as one of the essential healthcare team in handling critically ill patients. So I definitely hope that you take this challenge, for you to be able to be a part of this opportunity, a healthcare program that will able to deal with our patients. And I hope that you will be able to, once you graduate, take a board exam and train here in the Philippines first. And if you want to go to subspecialty, then you can choose whatever subspecialties that you want.
Thank you so much. Thank you. Sorry for our audience. I've been messing with the screen. But yeah, thank you so much for that great message. Truly, we need more respiratory therapists, not only in the Philippines, but, overseas too. And, it's a good profession whether you're staying in the Philippines or going overseas or retiring back to the Philippines. It's a wonderful profession. Next question. Next, I think next question or ask would be, what is your message to our fellow respiratory therapists, sir?
Oh, okay. Thank you.
Mm-hmm.
Right now, my message to all of my fellow respiratory therapists, not only at the time of pandemic,
Mm-hmm.
I think this is an opportunity for us to show to the other allied health professions of what we are capable of what we really are doing in the hospitals. We're not just because there's this connotation or there's this perception about respiratory therapists. I think not only in overseas but also here in the Philippines that I have been observing a lot of experiences from my previous students, also my experiences and also the experiences of my other fellow respiratory therapists that we have been being belittled a lot, and we've been called of many terms that we're just inhalation therapists. We only do suctioning. We can only do arterial blood gas as such. We're not really good into dealing with with critically ill patients. I think this is an opportunity for us RTs to really show to them or really prove to them that we do not have to be called as such because our profession we did not graduate 4 years of respiratory therapy just to be called as such.
Mm-hmm.
We need to show to them what our capabilities are. We need to show to them what our field of expertise is and how big and how large the scope of our profession is. We're not just only dealing, yeah, true enough that we deal with aerosol therapy, but there's a science into it. There's an approach to it. There's a protocol into it. We familiarize with pharmacologic aerosol pharmacologic medications that deals with patients with asthma or patients with COPD.
Mm-hmm.
Yes, it's true that we know oxygen therapy, but there is an approach on how to give a specific oxygen therapy device to specific patients. And we don't only do that just because we wanted to, because or we do not just want to say this is the better when doctors or nurses say this is a better approach. No, you give them the better approach because this is what you think is deemed necessary. We also look into patient's chest x-ray. We also do patient assessment. I think that is what I wanted to show to the artists here in the Philippines. To really do practice proper patient assessment, do read the patient's chart, interview your patient, really get into the deeper sense of what their condition, their diagnosis is, so that you can give them a proper intervention and management. Also, you give or you talk to your doctors. I think
Mm-hmm.
it's better that you also communicate with your doctors and not just only following. I'm not saying do not follow doctor's orders.
Mm.
What I'm trying to say is try also to get or have a take a what about your approach, an RT approach to the management of your
Mm-hmm.
patient. I think sometimes doctors needs to listen also to what you feel,
Mm-hmm.
you think is a best approach for your patient. Sometimes doctors are also learning from RTs in terms of the ventilator
Mm-hmm.
management, the better mode of ventilation to our
Mm-hmm.
patients. So I think it would be best for us to really have this kind of communication. I challenge also our RTs that our profession is not a petics mode. Okay, we don't just sit in our department and just doing nothing.
Mm-hmm.
There are a lot of things that we wanted to do and to do to our patients. And I think it's an opportunity for us again, like I said, show to the other allied health professions that we are not just like this.
Mm-hmm.
We are better of what you think we are in our profession. We didn't study 4 years. We didn't take the board exam just to be on a petting school. Okay, it's one of the most challenging professions, and I think we should be giving them that opportunity to prove to them that this is what we are as a respiratory therapist.
Thank you, thank you. Thank you for that. I do agree. I do agree. It's a profession that we, spent so many years, so many courses, their specialty, and then to be called as such is I would call it, it's a petty thing to just say those, because again, our job is to, hey, you're just inhalation therapist, you're taga-usok, it's we have to educate ourselves first, and we can educate other people to say that that's not what we do. We could do so much more. But then again, the support, all the respiratory therapists first. This is going to be controversial, but I will just take it. We need to be united as one. We need to be united as one. We are not respiratory therapists side A and side B. It should be just
Yep.
respiratory therapists with no side. It's easier to
That,
say from my end, but that's the way things should happen. So we need our people to unite. We ask humbly. This is what the respiratory therapists are asking for, and for sure many do agree. This is for our profession. It's not for you and I or someone else. It's for the profession, for our future respiratory therapists, for our, hopefully our current generation would experience a respiratory therapy with no side. That not only speaking for the Philippines, but also here in the United States, we do encounter a lot of discrimination or belittling from our allied healthcare providers or professionals. We do the same thing, but then we have to educate them of what we do, and we fight, and we're also advocating for a respiratory therapist as one group to be united and tell the world that this is what we do. Sir Richie, if I may ask you, you don't have to answer this, but you have explained or shared so much for the profession. This is what you wanted. This is what we wanted for our profession. You know, what can you share to us? You think that we need, besides, we need to do as one group respiratory therapist to happen to make this possible. Just what you can share besides of what you have
okay. Well,
mentioned earlier. What should we do as a group of respiratory therapists?
well, I think um, one of the most important things right now for us to do is to have a standard protocol or a standard practice of our profession as respiratory therapists. Because I think that, okay, probably this might be an observation from different institutions. Some may agree on this one, some may not agree on this one,
Mm-hmm.
but sometimes there are approaches to intervention and management that sometimes some artists are unable to understand or unable to be, or they're not not aggressive enough
Mm-hmm.
Because sometimes there are certain there are I'm observing this one that I think that there are some artists who will just do whatever they're being ordered to do so.
Mm-hmm.
Like whatever the order or doctor's order is, they'll just follow it. And they don't have the they don't have this kind of opportunity for them to speak up because they thought that even if I speak up, the doctors won't listen.
Mm-hmm.
I think that's the reason why that there's what we call a protocol or a standard of practice. If we
Mm-hmm.
do have that Philippine standard of practice of respiratory therapy that will be introduced by our organization,
Mm-hmm.
there wouldn't be any politics. There wouldn't be any conflict of interest. I think it's okay. I'm going to set aside whatever organization
Mm-hmm.
our respiratory therapist is joining. It doesn't matter if you're a leftist or a rightist group. What matters here right now is how are we promoting our profession?
Mm-hmm.
How are we educating our people of our profession? Okay, it's not because the one who leads the organization are not a purely because there are some certain issues like just because the leader of the organization isn't an RT, they were practicing RTs, but really they are not a full-fledged respiratory therapist or they are not a graduating or a BSRT graduate. But remember that whatever it is or whoever it is sits in the association has to think about the welfare of the RT profession in the Philippines. Because not only that, if we are having this kind of argument or debate about who's going to lead the group, but if both is not, giving the the initiative to really educate other healthcare professionals about our
Mm-hmm.
profession, then it's useless.
Right.
Siguro, the thing here right now is let's set aside our differences. Let's
Mm-hmm.
focus on how we can improve our profession. Let's try to unite as one in terms of a better respiratory
Mm-hmm.
profession in the Philippines. Um, all of us here and abroad wants to have better leadership, not just only in the leadership in the RT, but also a better president of the Philippines.
Mm-hmm.
You know what? Whoever the president
Mm-hmm.
sits, if we are supporting whatever the project is
Mm-hmm.
or whatever the protocols is, then we should follow it. It's also the same as in our professional organization.
Right.
Whoever sits in the professional organization, RTs or non-art artists by heart or artists by choice, okay, if we are helping each other to promote the best of our profession is and not settling for personal interest, then
Mm-hmm.
I think that we should be able to provide a standard. I think that's one
Mm-hmm.
topic that we should be. I would suggest probably the standard of practice in the respiratory
Mm-hmm.
therapy in the Philippines. Is it the same as with or at par with the practices or the best practices overseas? Because probably we might be left behind.
Mm-hmm.
Okay, it's not an issue of leadership. It's an issue of probably because we don't have the
Mm-hmm.
machines or the equipment
Right.
or the supplies that we can provide our patients. So again, it's not an issue here of political. It's an issue here of an initiative. So whoever it is or whatever it is, we should be informing our people, our fellow respiratory therapists to unite in terms of what
Mm-hmm.
we can provide to our patients
Right.
and also prove to all of the other healthcare professions that we are doing our best to provide the best and utmost respiratory care to our patients.
All right. Thank you. Thank you. So, for our audience, let us know your thoughts on the comment section. Also, in the social media age, you are free. Uh, you are free to comment whatever you like. I know that this is something that our friends will look into, will hear. We do appreciate your what do you call this, your input into this. But then again, tell us tell us Mr. Ritchie, it's gonna be controversial, but tell us: are we wrong to ask for unification? Are we wrong to ask for something that would benefit all the respiratory therapists? And I think that's it. Are we wrong with asking for those? Are we asking too much? I It's needed, especially in the time of COVID-19, where we are given the spotlight to shine. We have to keep that
Mm-hmm.
fire going while we still have it. We don't want to lose it. This is the perfect time that respiratory therapist is being put into spotlight, and we need that spotlight to get bigger and bigger for people to know who we are. But then again, we have to start with us, the respiratory therapist. So to our friends, to our audience, again, we are calling for action to support what is needed for the profession. Again, like Mr. Reach said, it's not left or right. We are center, and that's what we're looking for. And whoever it is there sitting or not, we have to help each other. By the way, there's elections for a reason, right? So, the Philippines is a democratic country, so let's practice our democracy. But whoever is in there, let us help each other instead of bashing each other. Or on that point, with this ang Artimo and party, we're not professional organization. We are a group of people who wants to share knowledge and education to our friends and use this platform to advocate for every one of you. So bash us if you want to, but we are doing this for the love of the profession. Uh-huh.
Yes, I agree. I agree. And actually, I'm actually thankful for thankful to you and to the FB group or FB page that
Mm.
you have tried to start, because it's giving us the opportunity to inspire other fellow respiratory therapists of what we can actually do and what we are as a respiratory therapist, not just only here practicing in the Philippines but also overseas. It gives us the platform to be able to say what we wanted to inspire our other RTs to work hand in hand in terms of promoting our profession.
Mhm.
This is a platform of opportunity for us as well to show the best practices, not just only here but also abroad.
Mhm.
We're also showing who who's who in terms of who are we looking up to in terms of our profession as a respiratory therapist. Actually, coincidental. It was very unfortunate for the RT community of the passing of Dr.
Mhm.
Robert Kashmir.
Mhm.
And the AARC already have acknowledges the demise, the ultimate demise of Mr. Bob Kashmir. I think that our officers in the board of respiratory therapy and also in the ARCPP was able to had the opportunity to meet him in the ICRC convention that was held in US.
Mhm.
And I would say that it would actually show my age because I had the book. Okay, I had the reference book of Mr. Robert, Dr. Robert Cashman, which is Essentials in Respiratory Care, and that was my review material when I was taking my licensure examination,
Mhm.
and having that experience together with some of the graduating or the just recently graduate students taking the boards. My experience, okay, because I'm taking the boards with the other, a younger respiratory therapist who's taking the board exam, and really, my textbooks or my review materials were actually some of them were actually authored by Dr. Bob Kashmir.
Mhm.
So again, um, let's disregard or set aside whatever politics or personal intentions that we have. Okay, again, regardless of uh, who, or what educational background or whatever school, because I think there's still that kind of the school supremacy. During the internship, there's what we call school supremacy. Who's the best school for respiratory therapy or who's not? It doesn't matter whatever school you came from. You have the same textbook. You
Mm-hmm.
have the same level of knowledge and learning about the respiratory therapy. It's just a matter of you understanding and communicating with your other fellow respiratory therapists in the approaches. You might have a different approach to your
Mm-hmm.
other fellow respiratory therapists, but your common goal is just the same, dealing and handling with patients.
Yeah.
So I guess it's important as well, also in the leadership, that we settle down whatever personal interest that we had, because our personal interests would not matter in terms of our professional development as a respiratory therapist. If we keep on insisting our personal interest in terms of our profession, then we can't go and we can't move on with how our association or how our profession is going to look forward to in the
Mm-hmm.
few years to come. At the time of the pandemic, what we are doing right now is to promote approaches or different approaches or protocols for us to improve our quality of respiratory care. And that's what we wanted to, yeah, to partake to our fellow respiratory therapists, that we should be doing this one for the benefit of our patients,
Right.
regardless of what the association is giving us, what the association
Mm-hmm.
is trying to imply us, or what the other groups are in trying to say, whatever it is. What is important is for us to be united as one, regardless of what our differences are.
Right. Yep. Agree. Thank you. Just read the comments from Mr. Kenneth Arevalo, our fellow respiratory therapist from Houston, Texas. He has also practiced in the Philippines, which we are waiting for your for a day off from Mr. Kenneth so he can speak and present, share his knowledge and expertise in an Artimo in the near future. Hopefully that will be soon. Let me just read it to everyone. It says, we have to unite and help each other by educating the new and future RTs. Definitely agree. And he said, I agree. Next one is at the end of the day, we are all artists. Agree, agree, agree. And again, we are here as one group respiratory therapist, the Filipino Association of Respiratory Therapists International Facebook page is again a non-partisan, not professional organization, but we are just a group of respiratory therapists who loves the profession and love one another. So we are here. Again, we are not. We this is informal. We use this platform, especially ang Artimo, to be available for all our respiratory therapists without that political side of it. So we are open to our friends, our colleagues and the respiratory therapists, which we already have sent our invitation to, and we are excited to have our guest speakers hopefully in the near future. If not this month, by next month, we would love to hear from you. Again, by educating and sharing their expertise and knowledge in this platform. We do appreciate all of you. At the end of the day, we are all artists and we are here for our patients and we are here for one another. Thank you, Mr. Ritche Caburnay, for getting to know you and sharing all your thoughts and sharing your respiratory life with us. We are now going to move on to our audience. If you have any questions, concerns, comments, please put it into our Ang Artimo YouTube channel. Please post your comments, suggestions, or whatever reaction you guys have. We will get to answer. We will get to have you. We will read your comment, and if we have time, we will answer your questions and queries in there. So thank you. We're gonna pause for a short break. As Mr. Ritche Caburnay will get to prepare for his presentation, RTs in Polysomnography, RTs in Specialty, and we will be right back. Just stay us for a short while. We will be right back. Thank you. All right, sir. If you can join
Yep.
again, with your other device, please.
Okay, yeah, sure.